Hi everybody, good afternoon and welcome to another Meet Your Future event as part of National Careers Week. My name is Michelle Wheeler. I'm part of the Bridge GM team at the Greater Manchester Combined Authority. So our Meet Your Future series of events was launched back in April 2019 to enable more young people like you to meet with and have meaningful conversations with employers while you're experiencing different workplaces. We've developed a lot of information, resources and services around this. They're there to help you, and you can find it all on our website gmax.co.uk, which is the Greater Manchester Apprenticeship and Careers Service. Hopefully a lot of you will already be using that and familiar with that website, but you can speak to your teachers to find out more. So throughout this academic year, there's lots of stuff going on. You're able to join sessions and chat and ask questions of local and national employers around the growth sectors across Greater Manchester, different pathways that are available to you, like whether to go to college, university or take an apprenticeship, and the vast range of careers opportunities available to you right now in Greater Manchester. So in this session, you're going to hear from a few people who work for the NHS. That's very exciting for us because it's such a big employer locally. We've got Chloe Hallows, who's going to be leading the session today. She works for the NHS Careers Hub, and we've got 3 ambassadors that work in lots of different roles across Greater Manchester in different places. And they're going to be talking about careers that and their roles using skills and knowledge that you learn in science. Hopefully this session will inform and inspire you and show you how you can be optimistic about the kinds of things that you could go into in the future right here in Greater Manchester. So through the question, there will be lots of time for questions. Please make use of the question box that we've got there if you want to find out more about anything that the speakers mention, and we'll be covering these at the end. So thank you very much for coming along, and I'm happy to introduce Chloe.
Thank you very much. Oh, thank you very much. So hello everyone and welcome to this session on science in the NHS, or careers use in science in the NHS. Hopefully this session will be useful for you, be informative, and we'll tell you a little bit more about some of the different roles that you can go into. As Michelle said, we have some ambassadors with us who are real people working in the NHS, working in this sector. So for anyone who wants to work in the NHS in general, who has a key who wants to have a bit of an insight into what it is actually like to work in a science-based role, or what it's like to work in the NHS or for a big corporation, this will hopefully provide you with all that information and will give you a bit of an insight into what is involved and everything that is available to you. We're going to start with a bit of an overview on the NHS and on sort of the sciences and how they're involved, and then we will jump into a bit of a Q&A. So as Michelle said, please do use the chat box, the Q&A box. That's there for you to ask any questions. There are no silly questions. There's no questions that are kind of, you know, off limits. Please do feel free to ask anything that you may want to know about the roles that these guys are in, or about kind of working in this sector in general, and the opportunities that are available. So as I said, or as Michelle said, I'm Chloe and I work for the Greater Manchester Health and Social Care Careers Hub, and we support all the schools in Greater Manchester in learning about the opportunities within health and social care, which obviously includes the NHS as well. So to kick things off, to begin with, and like I said, I want to give you guys a bit of an insight and overview into the NHS and what it's like working there and the opportunities that are available. So to begin with, I've got a simple question for you, which if you've been to any of my other sessions, and I apologise, and this is how I like to start everything because it's a key bit of information I want you all to take away, is how many roles are there within the NHS? So how many roles are there within the NHS? So use your Q&A or chat function to pop your answer in there as to what you think might be the correct answer. So do you guys think it is A, 350, B, 275, or C, 425? Okay, so pop your answer in the chat, A, B, or C. A, 350, B, 275, or C, 425, and we'll see what you guys pop in there. See who can get the nearest or the correct one. I know on my session yesterday there was a little bit of a lag by about 30 seconds. So if that's the case, and if you're hearing this a little bit later, I apologise if I'm not really on it in terms of answering questions and things, because sometimes with these lives there can be a bit of a delay with what I'm saying and when you're hearing it. So yeah, please, I apologise in advance if that's what's happening today. Gives me time for a tea break in between.
No answers coming through yet, I'm afraid, Chloe. So maybe just carry on. People can warm up a little bit.
Yeah, no problem. And you know, like I said at the beginning, this session we really want you guys to kind of get out of it what you want. You know, I've kind of framed it based on what I think you guys should know and what you should explore. But there may be other things you want to know that I'm not talking about, and so that's why using this kind of Q&A situation is really good, so you guys can have a little feel and think about what you want to know. So we're making sure it's really tailored for what you want. So how many roles are there within the NHS? The answer is 350. So there's 350 different roles that are available, and these include things like doctors and nurses, as well as physios, healthcare scientists. So there's loads of different opportunities that are available within the NHS. And the reason why I started this, because when we say name a job within the NHS, I'm sure everyone's first thought is nurse or doctor or surgeon or receptionist. There's certain jobs that we all think of, but there's so many more jobs that are available and so many more out there that we don't always think about when we think of the NHS. So remember, there are over 350 different jobs, so there's lots of different opportunities that are available to you. So a little bit of an insight then into what some of these jobs are, and I apologise I keep looking over this way, that's where my PowerPoint on my screen is. So the jobs that are available and that you can do within the NHS fit kind of quite nicely into these little sections. So we have firstly allied health professionals, and these are frontline staff that are working with patients, working in clinical settings, doing lots of different interesting things. So they are, for example, paramedics, physiotherapists, dietitians, podiatrists. So they work often with a specific part of the body or a specific type of therapy or treatment. We then have healthcare science, which we're going to learn loads about today, so I won't touch too much on that, but these are all the people who are working a bit more behind the scenes in very sort of science-based roles, as the name would suggest. Nursing and midwifery, often when we think of nursing, we think of a nurse, but actually there's lots of different types of nurses, adult nurses, child nurses, midwives, loads of people within that area. We also have people working in health and social care within the NHS, so as social workers or as other members of the community sort of support staff. We have corporate staff as well, so those are people who are working a little bit more behind the scenes and who are doing things like administration and finance, paying people's wages, human resources. So all that kind of stuff is done by corporate staff. And then we also have estates and facilities, which is again another area we're going to touch on a bit more today. But these are the people who look after the buildings that house the doctors, the nurses and the healthcare staff. They make sure the buildings are functioning, that they are working as a building, as a system, and also that everything inside of that building is working well. So, is the heating working fine? Is the air ventilation working okay? Does this piece of equipment work how it should? And that's what estates and facilities does. But again, we're going to explore a little bit more like that, a bit more about that in a moment. So my next question here for everyone today is the NHS workforce is the blank workforce in the world. So do we think that the NHS is A, the second largest workforce in the world, B, the 5th largest workforce in the world, or C, the 10th largest workforce in the world? So I'll give you a few seconds to kind of answer that, and then we'll reveal the answer. So is the NHS workforce is the blank workforce in the world? Is it the A, second largest, B, the 5th largest, or C, the 10th largest? What are we kind of thinking? That's in terms of the amount of staff we employ and that work for the NHS. Give a few seconds and I'll reveal the answer. Okay, so how many people work in the NHS? How big is our workforce? So the NHS is the 5th largest workforce in the world. So often people go for the 2nd largest because they think, oh, it's really big, and that's true, but we are the 5th largest. To put that into perspective, we have a workforce of 1.5 million people, so that is a lot. And to put it into perspective in terms of who is number 4 is McDonald's. So McDonald's are just above us, they've just beaten us. And I think that's quite impressive because the NHS is just the UK. So we don't work in any other country, we just work in the UK. McDonald's is everywhere. McDonald's is in every country, in every town, in every village. In Manchester, I don't even know how many McDonald's there are in Manchester, a lot. So I think it's really interesting when you start to think of it like that. It's like, wow, there are so many different opportunities, so many different people. And often people come and ask me, you know, what do I need to do to work in the NHS, or what qualifications do I need to work in the NHS? Those 1.5 million people are all very different. They've all come in it with different experiences, different interests, different things that they enjoy, that they like doing, different areas that they want to work in. And so not everyone's the same, everyone's different. So when we're thinking about working in this sector, there are so many different opportunities that you can do, and so many different things that you can go into in the future. So that's why I always start with this, just to really emphasise the scale of the NHS, the system that we work in, and the amount of opportunity that are available. Today we're obviously focusing on a small part of that, but I think that's something to bear in mind once you guys start your research and start thinking about what it is you want to do in the future. Okay, so some of you maybe before this session might have done some activities, some of you may not have. So I just wanted to kind of give you some of the answers to these, and for those of you who haven't, to give you a bit of an insight into what are the areas that we're going to be looking at today. So that is healthcare science. So there was a few questions that some people were given before, and one of those is, what is healthcare science? So as I said before, we're going to be focusing a little bit more on this today. So healthcare science is the staff play a key role in prevention, diagnosis and treatment of lots of different medical conditions, and they also help people live independent lives through rehabilitation. So healthcare scientists, when you go to the doctor and they may ask for a blood sample, that gets sent off to the lab, and you think it gets sent off into thin air, and then the doctor suddenly comes back and says, oh, this is what the problem is. That gets sent off to healthcare scientists who look at that, who analyse that, and who see what the issues are. They also do research into different conditions, different things, and they also do some work on the treatment as well. So healthcare scientists are people like physicists who may work on the machines that help with the treatment and the development of treatment plans for patients. So that's what healthcare scientists do, and healthcare scientists fit into a few different types. So like I said, they do a few different things. That was another question that you guys were asked. So first, we've got laboratory sciences, so people looking at hematology or microbiology. We also have people looking at the physical sciences like audiology, vascular science. We have people working in medical physics and clinical engineering. So those are people who like fix the machines, who are looking at that kind of physics side of the NHS. And then bioinformatics as well, which is like computer science and health informatics. So those are some of the areas that you can work in. And I'm sure some of you guys are thinking now, oh, I've done some stuff about that in my biology class or in my chemistry class or my physics class. You may have heard of people studying microbiology. And I'm guessing some of you might not really realise that you can do that in the NHS. It's an area that you can work in for the NHS. It's not all. Obviously, a key part of our role is dealing with patients as they come in and talking to them and treating them. But another part of that is everything that goes on behind the scenes that we don't always know about and we're not always aware of. So there are over 50,000 healthcare scientists in the NHS. Over half the NHS workforce is non-clinical. And what we mean by clinical is people who deal with patients face to face. Non-clinical are those behind the scenes. half of the workforce is non-clinical. So again, it's not always how we think of the NHS and how we think of what is available. And the final question we asked you here was what percentage of diagnosis come from healthcare scientists? Now, this is quite an interesting one that I didn't know before. And again, when we talk about diagnosis, we often think of that coming from your doctor or from a dietitian or a physio or whoever you're seeing. But actually, about 80% of all diagnosis come from healthcare scientists. So they are the ones who are looking at your samples, looking at that information, and making those sort of investigations and judgments on your diagnosis and your healthcare needs. The doctor then take that and then do whatever they want with that information, but a lot of the diagnosis will come from healthcare scientists. So although you might be behind the scenes, it's still a really big part of the patient journey, and you're still having that massive contribution to the patient experience. So we're going to hear from some healthcare scientists today, and you're able to ask them some questions. But hopefully that's given you a bit of an overview as to what I mean by healthcare scientist. Okay, so the next thing we're going to look at before we dive into our Q&A is, where is science used in these roles? So we've looked at healthcare science as one particular part, and to be real, all of these jobs will use a part of science in their profession, but I can't talk about 350 jobs today. That would take me about 10 hours. So I'm just going to focus on 2 types of jobs. But yeah, these all will use aspects of science. Your corporate staff will use aspects of science in terms of their, looking at the computer science side of things, data collection, that's all science. Nurses will use biology and chemistry and physics in their role. Even though your health and social care staff, they will still use science in their job. A lot of the NHS uses science, and a lot of jobs actually use science in their roles, even where you maybe don't expect. But yeah, today we're looking at healthcare science and a little bit on estates and facilities as well. So what do I mean by estates and facilities? And don't worry, I'll start talking in a minute and then we'll go to our Q&A, but I just wanted to give you this background before we jump into it. So estates and facilities. So there's the different types of people working in estates and facilities. And sorry, my animation is very strange. Okay. So we have people working in domestic services like catering, cleaning, housekeeping, linen. So like I said, estates and facilities look after the buildings themselves, and they look after the things that are in the building. So not the people, but the beds, the linen, obviously the catering, all that kind of stuff. So you also then have estate services, electricians, maintenance, building surveyor, building management, all that kind of stuff that looking after the building itself. Heating, airflow, you need all of that to operate as an institution. Those things are essential, and they're essential to the patient experience and the patient knowledge and development. And then we have support service as well, people who are working in security, in health and safety, all that kind of stuff. So like I said, estates and facilities are really kind of looking after the buildings and the equipment within the buildings to make sure it all runs smoothly and to make sure that it's safe, that it is fit for purpose, and that the doctors and nurses and dietitians and physios and all them can do their jobs basically, and they wouldn't be able to function without estates and facilities. And so we'll be hearing from some people in a moment who can tell you a little bit more about what their jobs are and what they look like. And remember, throughout this, you can ask any questions. You may want to ask me some general questions, or you may want to ask them some specific questions about their role in the Q&A box, which if you go to the top of your screen, you'll see that there's a little symbol that's got like a little question in a bubble, and that has your Q&A in it. So if you want to ask any questions, you can do so through that, and we'll make sure that this session is really looking at what you guys want to hear about. Okay, so without further ado, let's move on to our ambassadors. I'm going to stop sharing my screen and stop talking because I'm sure you are all sick of my voice. So I will stop sharing that screen now, and we'll go to our ambassadors. I don't know, do we want to start with Easy? Are you okay to kick things off for us? If you just want to give us, what we'll do is everyone will give a bit of an intro in terms of who they are, what they do, and then you guys know who we're looking at now, who we're talking to, so you know how to frame your questions. But yeah, Edie, do you want to kind of kick things off for us? Is that okay?
Yeah, of course. So hi everyone, so my name's Edie, and I work in medical physics at the Christie, so that's the cancer hospital in South Manchester, and I work with the diagnostic radiology and radiation protection group. So what we do is our group is kind of split into two sections. So the first half, as I said, diagnostic radiology, so that is working, diagnostics is obviously looking at patients when they come in and trying to diagnose them with their illness. And we do that using x-rays. So if you think about your science, obviously x-ray is part of the electromagnetic spectrum. As we pass x-rays through the patient, we can detect them on the other side of the patient, and we use those x-ray images to diagnose the patient. So a lot of people will have had what we call a planar x-ray. So that's just if you're broken a bone in your arm, stick your hand in the x-ray machine, they go straight through onto the other side, and that's how we diagnose a broken bone. But there's lots of other ways that x-rays are used as well. So in things that you might have heard of, like a CT scan or a mammography scan. So there's lots of ways that x-rays are used. And what we do as physicists with those x-ray machines is we are generally checking for their safety. So we're checking things like the x-rays aren't leaking out of the side of the machine, because that would be quite dangerous. We're also checking that the image quality is good. There is no point us kind of exposing you to x-ray radiation if we're not going to get a good image out of it. So we do lots of tests to make sure that the equipment is working the best way it can. So that's kind of one side of our work. And then the other side, as I said, is the radiation protection group. So that is just basically ensuring that the patient, when they're being exposed to x-rays, that's being done as safely as is possible, and as well the staff are safe, which is really important, and maybe any members of the public that are in the hospital, that they're safe as well. So that's the kind of overview of what our group does. And just to tell you a little bit about what I kind of like maybe a typical week would be. So we maybe spend 1 or 2 days a week at a hospital across the country testing their equipment. And then we'll kind of come back to base at the Christie, and we'll do lots of calculations and just provide them with kind of the knowledge that either their equipment is safe, or we'll let them know what the equipment kind of needs doing to it to fix it. So that's what we do. And just to tell you how I got into that, so I did my GCSEs, and I always really liked physics. So I went to A-level to do A-levels in physics, maths and further maths. And from there, I went to university to do a degree in physics. I started off doing astrophysics, so like looking at space and things, and then I decided I kind of wanted to do something a little bit more practical. So I heard about kind of healthcare science in my second year of university and decided that's what I wanted to do. And it's a really great way of kind of being able to actually help people and help patients, while also still being involved in physics and maths and all kind of like the cool science like that. So that's what I do, and if you have any questions about that in particular, please let me know.
Great, thank you. James, I don't know if you want to go next, because I know yours is a similar role to what Edie does. Are you part of the same team?
So we work in the same hospital, but in a different team. And our sort of offices are down the corridor from each other. Yes, so I'm the sort of same cohort as Edie's, and training to be a radiotherapy physicist. So I'm specialising in a different area. I think to explain what I do, maybe introduce what is radiotherapy. So it's the controlled use of radiation, used to treat mainly used to treat cancer, but there's also a handful of other conditions it can be used to treat. And it's mainly done using X-ray beams of much higher energy than the ones that Edie uses in imaging. So these are from specialist machines called linear accelerators, or you can use X-ray tubes similar to what is used in imaging that are just a bit more powerful. You can also deliver treatments with radioactive sources and radioactive medication. And the treatments that they're prescribed by specialist doctors and given by specialist radiographers. But the role of the physicist is that we support that delivery of the treatment. So we're involved in planning patients' treatments, because every treatment's tailored to the patient, because everyone's different inside and everyone's cancer is different, so everyone's condition is different. a lot of tasks are done by computers, but you need a human input to check that the computers are doing what they should be doing. And you need that physics understanding to check the results that come out of our treatment planning system. We're also involved in a lot of setting up and testing the equipment to make sure that they're safe and doing what they should be doing. A key thing in radiotherapy is consistency, because treatments are split across many days. So you need to make sure day to day that the treatment machine is delivering the same amount of radiation to the patient. Also, just in terms of variation across patients, to make sure that treatments do work as they should. You can't have that variation between departments and between treatment machines. So we do lots and lots of measurement work, checking that things are essentially the same, and then forming plans of what to do when things aren't the same. We also sort of have duty that we call bleep duty, where we're essentially a help desk for the doctors and radiographers and planners, where if something unusual happens or they're not sure about things, we're like on call, and we can go and have a look at the problem and see what's going on and provide the physics knowledge when it's needed. And one thing, so all these things I absolutely love working in it, because it brings together physics with biology, with chemistry, maths, engineering into one thing, and every day is different. And you get to work with a good mix of people, and it's not just other physicists that day to day that you're dealing with. And like I said, every single day is different. Say a bit of how I sort of got here. So yeah, like Edie, I really liked science when I was in school, and I was sort of drawn to physics because I've always wanted to. I was sort of asked, like, how does this happen and why does this happen? And I found that physics sort of answers those questions. And as I went sort of from school to college, the physics was the thing that really interested me. So I went and did a physics degree, and liked the sort of hands-on applied side of things and using physics to help people. I wasn't entirely sure when I came to the end of that degree what I wanted to do, and one of the options was to train as a clinical scientist, and the other thing was that I did really like the research side of things, so I ended up going down the research route and did a doctorate in applied physics, making explosive sensors, and that was really fun, really great experience, learned loads of skills. But I came to the end of it thinking it wasn't something I was interested in long term, and again I was at a stage where I didn't know what I wanted to do. Ended up I spent a year working for a tax consultancy, helping companies that were doing research claim money back for the tax. That was an interesting mix, but it wasn't, at the end of the day, it wasn't as interesting as something that directly involved physics. So then I ended up applying for the NHS scientist training programme, and I'm a year and a half into that now and absolutely love it, and it's definitely what I should have been doing. But the flip side of it is, from doing the research work and even doing the non-physics work, there's skills and experience are valuable, and then sort of the science knowledge is useful in the job that I'm doing now, and it's also been useful in the jobs that I've done that haven't involved healthcare and haven't involved physics directly.
Yeah, that's great. Thank you, James. So interesting, I suppose, to hear about your similar but two quite different jobs. And I was having a conversation earlier on actually with students who were looking at diagnostic and therapeutic radiography, and how they're obviously they're linked to your roles, and how they're different and what they kind of demonstrate. But yeah, that's thank you so much for your introductions. Last but not least.
Oh, hello there. My name's Elke Mackenzie. I work at Tameside Hospital. I'm a building surveyor, so I work in estates and facilities within the estates department, which is also referred to as hard facilities. My job as a building surveyor is basically, I'm a doctor, if you want to take that analogy, of buildings. So my role means I'm responsible for the planned maintenance. So, for example, if we have a leaky roof, I have to have a look at that. You know, we might do a reactive targeted repair in the short term, but if the whole roof needs replacing, then we have to have a look at, first of all, how we're going to, what specification of the works, what construction technology is best to be used for that building. We will have to cost the works, send the jobs out to tender, and then I have to manage the contractors. I work also with drains, holes in the ground, fixing a dry riser, but then I also do nice nice bits as well where I can go in and refurb maybe a ward or offices, and that's really my favourite part of the job, because that makes lots of people happy. I see most people that work in the NHS as my customers. Patients are my customers, the staff are my customers. It's my role working in a support function to make sure that I make sure all the facilities are in good condition so they can crack on and do their work, their really important work, looking after patients. Yeah, and that's it. So I have only been doing this job a year. I joined the NHS a year ago. I'm quite old now, I'm 47. I am not naturally an academic person. So if there's any of you out there worrying, thinking, oh gosh, I'm not sure if university's for me, or if you know, even feel that, yeah, you know what you want to do and want to commit to a university course. I know you're probably a little bit young now, but you know, time flies. Don't worry, just don't panic, because there are lots of routes and there are lots of opportunities in the NHS for young people like yourselves. We have an ageing workforce in the NHS, and young people are in high demand. So yeah, just stay engaged, keep asking questions, and don't panic. You know, there's lots of routes. I left home at 16 and I worked. I went back to college at 17, did my A-levels part-time. I just worked really, really hard. I had a career without any great qualifications. Had a child, single parent, decided to move to Manchester, took a job working in a school for 5 years to manage family. And then I decided, and I realised that now qualifications are important, but there are lots of routes that you can go through to achieve those qualifications. Years ago, I don't think they were quite so important, but HNCs, for example, you could do BTECs, you don't have to do A-levels, you don't have to go to university, you could have a job, you could study and get a degree and also get that funded through the NHS. There's lots of opportunities with apprenticeships that way. And also when you're in the NHS, they really do value you as an employee. And if there are any training courses, I have to say I have never worked for an employer that's been so good as the NHS with providing training opportunities. But yeah, what I would say is don't panic, just stay in the conversation, keep asking questions, and you know, just get to know what jobs are out there and see if anything takes your interest.
Great, thank you so much. And I know within, like you said about training opportunities, in one of my other sessions we had someone from your trust who was working with estates and facilities, who was doing an engineering. Well, they started off from college, gone into engineering with the trust, and did, I think, probably a HNC or a HND, and they're now on the university apprenticeship route to become an electrical engineer through your course and through estates and facilities. So there are just so many, like I said, there is a lot of opportunities, and it all depends on what you guys are interested in and what you want to do. I mean, James's route sounded very like academic in terms of your doctorate and exploring physics, and so did yours, kind of, Edie, as well. So if you really like to study and get in depth with a subject, then that could be really interesting for you. Or if you want to just sort of get hands-on, get into the workplace and get kind of learning on the job, then again there is those options available. So yeah, so many different opportunities. I saw, Michelle, you were kind of jotting some stuff down. I don't know if did you have some questions that you wanted to ask?
Yeah, thank you. Thanks, Chloe. I was actually writing down as James and Elka and Ida were talking, and we haven't had any questions coming from the attendees, but hopefully I've been scribbling down lots of information from what everyone else has been saying. But I wanted to ask James in particular, you mentioned the scientist training program that you're on now, and so if you could talk through maybe why you went down that route, following your doctorate, and then what kind of further study or development that kind of involves. And then also for Edie, you mentioned you sort of settled on healthcare science at university. So did you take placements when you were there, and how that all worked? So yeah, maybe James first, if that's okay.
Yes, the scientist training program was something I'd found out about when I was finishing my undergraduate degree, and before I went off and working in research. And it was sort of, I thought, well, I'll apply to both and then see where it goes. And then sort of the research side of things moved quicker, and it was a less stressful application route. So I thought, well, I'll go down this route and see what that takes me. And then it was, again, being at the page where I don't really know what I want to do. And I was just sort of looking at the opportunities, and then got reminded that the STP was the thing, and then applied for that and got through the application process and the interviews, and started at the Christie September 2020.
Brilliant. How long does it actually last for?
So it's 3 years, and you've got workplace training alongside an academic part where you do an MSc in clinical science. And the first year of the job is that you spend a few months in each specialist area where physicists work, and get an experience of what sort of physicists do in the NHS. And then, so the role I applied for, I knew that I was going to be training in radiotherapy, but other trusts have you come to the end of that year, and then either you make a decision or you get allocated to where they need people, where they need the extra people training. And yeah, so I'm sort of halfway through the second year now, so I'm working specialists, still getting the specialist radiotherapy training.
Fantastic. I genuinely didn't know that existed. That's excellent. And the MSc alongside it, brilliant.
Easy, that's all paid for by the NHS.
Yeah,
and you get paid while you're doing it as well, which is a big plus.
Absolutely, yeah, for sure. Yeah, Edie, would you mind talking about your sort of experiences at university and why you chose the NHS after you graduated?
Yeah, so actually my whole family actually also all work for the NHS in various roles. So I kind of grew up with both my grandparents and both my parents working in the NHS in lots of different areas. So I kind of have always been very passionate about the NHS. So kind of really the only way that physics kind of fits in is obviously with healthcare science. So that's kind of the route I decided I wanted to go down. So once I'd kind of decided that I'd really like to work for the NHS with my physics degree, I did go and do a placement at the Christie actually, which is where I'm at now. So with the different physics department, with the nuclear medicine department, which is a whole other kettle of fish. So I did a placement with them during my summer holidays at university. So I did a 6 weeks placement, and then I decided that this was a job I could really see myself in. So I then went and did a master's, and as part of my master's project, my research project, I did that again with the Christie. So I really kind of got myself stuck in there straight from uni. It is a little bit hard now, I think, especially at school, to get kind of any experience with the NHS because of COVID. So I think, for example, I think we used to take on a lot of work experience, younger students, but I don't think that's so easy to do now. But I think there are still ways you can kind of get yourself involved. There's obviously sessions like this, and then I know as well that the Institute of Physics and Engineering and Medicine, so that's shortened to IPEM, they do a lot of stuff for school children. So for anyone who kind of is maybe interested in doing healthcare science, specifically kind of engineering and physics, and that's a really good way to get involved, which is something I wish I knew about at school as well, because I'd never even heard of a medical physicist until about 3 years into my degree. Considering I was doing physics, maybe I should have heard of that. But I think it's really great to just kind of know your options, especially when you're at school age.
Thanks very much, Edie. Chloe, I think we've got a couple of questions in the chat.
Yeah, sorry, I just started talking and I was like, oh, I'm on mute. So yeah, thank you both. That was really interesting. So there is a question here, which I suppose both Edie and James, you've kind of explained already a little bit, but I don't know if you can clarify further and maybe talk about your work with maybe the radiographers sort of doing the treatment. But someone's asked, how do X-ray machines work? So I suppose, Edie, this is your field, isn't it? Yeah, and so I don't know if you can talk about how maybe they work. It's simple. I'm trying to think of how I can understand it, but yeah, and also I suppose how maybe you work with the diagnostic radiographers to use the machine, if that makes sense.
Yeah. So X-ray machines, They're all obviously, so they're plugged in, so we're using electricity, and we have something called a metal filament, so a thin bit of metal, and we kind of run a load of electricity to that, and this kind of makes the metal heat up and get really, really hot. And when it does that, it goes through a process that you might have heard of called thermionic emission. So in this case, the electrons kind of all escape the metal, and electrons are negatively charged particles. So as you probably know, something negative is attracted to something positive. So we have this kind of these negative electrons on one side of the machine, and then the other side of the machine we have something positive. So by releasing these negative electrons and having the positive part on the other side, the electrons kind of accelerate across the X-ray machine to hit the positive metal. Hope that makes sense. And then once those electrons hit that positive thing, that positive bit of metal, they kind of interact with all the atoms in there. So the electrons coming in, interacting with the atom, and all these interactions kind of ultimately end up in X-rays being produced. So the X-rays are produced at this point in the machine, and then we kind of filter them out through the end of the machine, and that's how they come out. So we want to make sure they're in a nice small beam, that they're not just the X-rays aren't coming out all over the shop, because as you probably know, radiation can be dangerous. So we want them just to be going in a nice small beam towards the patient. So hopefully that makes sense. And then also, I don't know if you want me to the medical law opportunities, that's also me as well.
Okay.
I mean, I'm sure Elka also there's probably a lot of law involved with building now. So as part of my job, as I said, the radiation protection side, that's very legal, which is something I didn't really know until I started the job, because obviously I'm a scientist, I'm not a lawyer, but there is a lot of law within that area, because as we said, radiation can be dangerous. It's really, really important that there's regulations in place, legal regulations that kind of restrict who can use radiation, what they can use it for, how much radiation they can use, and where that radiation can go. So there's a lot of law involved in that, and that's part of our work, is that we'll travel around different hospital sites and check that they're complying with the law. So it's even things like, if you have an X-ray in a room, X-ray machine in a room, you have to have a sign on the door that says there's an X-ray machine in that room, and that's part of the law. So we have to go around and check that they are all complying with legal, basic legal requirements like that, but also more complex legal requirements, with kind of like more how they're using their X-rays and how much X-rays they're using. There's kind of limits on how much kind of power the X-ray machines can have. We have to check that it's all kind of complying with that. So that's kind of our side of law. I'm sure there's a lot of law also, I suppose, with like checking the professionals are working correctly as well. So things like doctors need to be held to quite a high standard. I can't really talk about that, but I know that there are medical opportunities for law in that way.
Yeah, and I suppose it also kind of fits into stuff like like human resources and finance and all that kind of stuff. Things have got to run in a certain way. And I suppose, Elka, with you in terms of the building surveying and management, there's there certain regulations there kind of that you have to follow and know of?
So yeah, so it's more about compliance. So within our department, we're also responsible for all the services like medical gases. So I'm actually an authorised person for medical gas, and you do have to undergo training. So it's more about compliance and ensuring that all the works that we do are compliant and do adhere to any statutory, regulations or laws or whatever. And so yeah, so it could be, for me in my department, one of the big projects actually that I've got on site at the moment is an asbestos decontamination project of our boiler house. So our boiler house is really, really old. Our boilers are from the 1960s, and believe it or not, our heating and hot water to our main hospital buildings are provided by steam. So we're trying to keep them running. The building that houses the boilers is full of asbestos. Asbestos is a dangerous material which has to be managed in the correct way. So I guess science comes into it here. I employ analysts that are the experts, and they will make sure they do air tests and make sure that the environment is safe. And as all the asbestos works are going on in an enclosure, I mean, it's quite complex actually, this project, but we have to make sure that we adhere to the HSE, to their rules, and we have to notify them of the works, and that sort of compliance does have to kind of, it covers so many operations within the hospital. Medical gases, water, for example, Legionella. We have to make sure, and we have to be able to prove that we're testing the water for contaminants, and that, you know, the actual components that we use for plumbing actually meet are compliant, and that they mitigate any risk for infection entering, you know, the systems, the water system. I could go on and on and on. We also have to plan for emergencies. So we have backup generators, which is N+1+1. We have many, you know, so say, for example, if there was a power cut or a water supply, you know, no water supply, or we you know, backup generators. We've got, we have to plan for everything, and we have a legal obligation to do so, and we have to prove that we are compliant. And we've actually just had a compliance audit, and I'm in the process now of compiling for my area all the documents to prove the level of compliance.
That's so interesting. And I suppose then in your role, I'm guessing you interact, I suppose, with quite a lot of different professionals working in the different areas. So I'm guessing you have to work with like the engineers and the people who know about the gases and how they all work. And so I suppose, are you working quite a large team of different people with different knowledges? And do you have to kind of, I suppose, then understand a bit of that and kind of try and grasp a bit of an idea of where they're coming from? Because I'm guessing there's quite a few different things that you're working with, aren't you?
Yeah, I mean, this is the great thing, and I'm sure Edie and James will, you know, agree. When you're working in the NHS, you're working with so many different departments, and you're all, you know, reliant on one another, really. And you do pick up lots of knowledge across the board. But I really do value the team and, you know, their expert knowledge. You're not expected to know everything. However, you do pick up knowledge. And the great thing is in the NHS, you know, there are so many internal departments, you know, from procurement to, I've been working on a project in our CTMR department recently. So Edie, some of the things that you've been talking about I found extremely valuable and you know, worth knowing, and some of it I kind of already picked up. So, you know, it's great. You do learn a lot, and what you don't know, there's always somebody around, you know, for you to learn from and who does know. So yeah.
Thank you. James, I suppose it's a slightly different direction now, but James, I was interested when you were talking about how you said you work with the patients quite a lot. You used to work with professionals to develop their treatment plans and things like that. And I suppose, because your background is more kind of the academic sort of research side, how did you find, I suppose, transitioning into where you're having to interact quite a lot with patients? And did you find, was that quite easy transition for you, or do you find some aspects of that quite hard?
I found actually there's sort of a lot of similarities between sort of working in the research environment and in a hospital physics department, which has been quite nice because it's sort of quite familiar. And in terms of patient contact, there's some jobs that do involve physicists having a lot of contact with patients. So there's some thing called in vivo dosimetry, where we take measurements of dose as they're getting the treatment. We're involved quite a lot there, but in terms of that, doesn't happen very often in our department. So sort of the patient interaction in the treatment planning, we work a lot with a patient's CT scan, and sort of work with the planners and the doctors on that side of things. But yeah, it's sort of there's a lot of familiarity, and it's something I enjoy, and I enjoy the working with people. And yeah, it's the applying physics in a way that has a positive outcome, and you can see it helping people, which is what drew me to it.
Yeah, because I was just going to ask, do you get to see, I suppose, because I suppose you might see that there's a patient and this is their treatment plan, and do you get to see, I suppose, the result of your work, and I suppose you may work on these machines, and then do you get to see kind of how the patients has got on, or is that kind of removed from you?
Generally, it's sort of that you do the treatment plan, or you deal with the treatment machine, and then that's it, and the patient goes off on the journey. But there's things where you can follow things up, and if you talk to the radiographers, that because they're involved day to day, they can let you know, or we can track the patient notes when we're doing the treatment plans. You can get to know the patient, even though you don't get that much interaction. You can get to know the patient from, there's information in there that's relevant to the treatment, and it sort of is quite interesting, because it's like you're dealing with people, and it's like a nice reminder of what you're doing does make a difference, and it's somebody's life that you're affecting in hopefully a positive way.
Yeah, that's great. So I suppose you work probably quite closely then with, because when we talk about the NHS, you always talk about like multidisciplinary teams and the fact that you're working with lots of different people. And I suppose, well, all of your roles are the case. I suppose, James, in your role, I'm guessing you work closely with therapeutic radiographers and people like that. So I suppose that's quite, and I suppose if anyone's thinking about James and Edie's role, if anyone's sat here thinking, oh, I quite like the science physics side, but maybe I want something that's a bit more facing patient contact, I suppose those kind of radiographer roles are maybe quite a nice little balance between the two. Like, you'll still get to use the machines, you'll get to learn a bit more about how they work, but then you'll also get to follow the patients as well, won't you? Which I suppose is a little bit different to what you guys do. Yeah, that's great. Thanks for those questions, everyone. Michelle, did you have any other questions that you wanted to ask?
No, I think we've got only a few, 5 or so minutes left. So I really appreciate that. That was super fascinating. Thank you, each and every one of you. That was really interesting.
It's been so interesting listening to you, and thank you so much for sharing your stories and answering those questions. I've learned quite a lot today, actually. Like, I always come out of these sessions and I do these like every day. This is like my 3rd one today, but I still like come out and be like, oh, I didn't know that. Like, it's still so interesting. So for you guys listening, even if you've been researching the NHS and you feel like you know everything, actually you learn something new every day. And I'm sure you guys in your jobs, I'm guessing you've interacted with so many professionals where you're like, oh, I didn't know that was a job, or I didn't realise you did that. Like, you're all nodding like, yeah, I come into contact with so many random people that I didn't really realise that they were there before. So yeah, so thank you so much. So I suppose just to wrap up then, and I'm sure, Michelle, you've maybe got something else that you want to sort of say to finish off with, but I just wanted to highlight that I know a lot of you have been given, teachers, you've been given some sort of activities that you can do. The session that we have here on your activity sheet is a little bit more about the engineering sort of side of things and technology. So if you want to, on this sheet, basically what I'd like you guys to do is to look at these images. And maybe see what different roles that you think someone might do. So someone might be an electronic engineer in this room because there's different equipment. And then what I really want you guys to start thinking of, and Edie and James have really eloquently sort of demonstrated this today as well, is how it impacts on the patient. So for example, one of the engineering roles here is something to do with kind of like airflow and systems, and that makes sure that the site is safe, the room is safe. The impact on the patient is that they're in a safer environment, that they're getting their treatment on time, that things are running smoothly and everything's being kind of exact for them. So there's a sheet there and there's some information for teachers as well to support with that activity if you'd like to kind of follow this one up. And yeah, if anyone's got any further questions or has any follow-up questions for these guys or wants to know any more information, please do feel free to drop us an email, careers.hub@mft.nhs.uk, and I can forward on anything that you guys want to know. But yeah,